Veterinarians are hesitant about offering paid telemedicine because they're worried that they may not be able to diagnose every disease accurately when they're not seeing the patient in person. This case illustrates how you can actually create more safety for your patients by bringing the client closer to the doctor. So this is a telemedicine case that takes place over 2 days but involves the same client and patient. This patient I have a VCPR with, and the client I do as well. So the owner says everything's blacked out or blued out so that her identity can be preserved. And that first thing as far as is just how payment's dealt with on Medici. But she says the dog's been vomiting. So I ask for a picture of the gums and the age. And so she sends me the dog's age and then a picture of the gums. And this is such a great picture, so you can appreciate how the gums are nice and pink. And then this video. So when I assess from this video nice and pink, the dog can sit up. There's a lot of things that we can infer and that we can realize from this short video. But the owner did a very, very good job. So I say, gums look great. And then I start to ask history questions. Did the dog get into anything? Yeah, she says the dog got in the trash. How's the dog acting overall? And she says, well, she's just laying around. So at this point, I have a VCPR. I feel comfortable that the dog is stable, but I want to assess pain and, again, just overall mentation of the animal. So I have her send me a resting respiratory rate. Not rate, but I can count it. The dog's probably a little bit faster than what I would anticipate. That's more than 30 breaths per minute. Any diarrhea? She said, yep, the dog's stool are runny. So at this point, I feel comfortable diagnosing gastritis. But then what I can do is I continue to give the owner access to me, and I tell her what to do if things continue. So if she continues to vomit, I want to take an x-ray. And then I start to talk with her. So this is 5:35. And it's super important to realize. You say, oh, well, I'd have that dog come into the clinic. The owner doesn't have unlimited funds. I don't have unlimited time. So I was able to take care of this client and my patient later in the day. I was done in the office at 6 o'clock. I had a full schedule, but asynchronously, I was able to text her and move through that. In the town that we serve, the emergency clinic just recently got shut down. So there's always the ideal, but that doesn't always fit what's best for my client or even feasible for my client. So as you watch this, know that this is a very sought-after service for my clients, that she can get care. The SOS emoji is just communication inside the office. The client doesn't see that. And then she said, great, I'll notify you if there's any changes. This is instrumental. This is key. She has access to the professional. She has access to the doctor. That makes my patient a lot safer. She'll monitor the patient, but she can reach out if anything changes. And that's what you're going to see. Things are going to change. Okay? She's only 10 minutes away. Only visible to colleagues. That's in-office communication. I prescribe medication. Again, ignore the emoji. That's just in-office communication. I push the telemedicine fee, and then she comes and she picks up the medication. She has questions in regards to how we are doing curbside, and we tell her. The SOS message, what that means is I need somebody from the office to look at the conversation. All right, so she's here. This then is the consult summary that then gets put in the medical record. All right, now this is the next day. So now we're at the next day and we're 9:23. She said, oh, she's not any better, and now she's defecating blood. Okay, this is super important, and it's great. This was instantaneously. She sends me that text at 9:23, and look at that. Now, it's asynchronous, but I get the message. She doesn't have to wait for a call back. My technicians, my receptionist, they don't have to triage this. It goes right to the doctor. That creates a whole lot of safety for my patients when she can reach out and have that type of access. Sends a picture of the diarrhea. Yep, that's definitely bloody diarrhea. How's her overall attitude? And she says she's very lethargic. Okay, she sends another picture of the gums. Great, good. Circulation maybe a little bit drier, kind of hard to assess. So now I feel comfortable at this point making a diagnosis of HGE. And again, I'm going to send her a link. So telemedicine is so much easier to educate clients so that they can start to explore and educate themselves because they're going to look on the internet anyway. Let me give them something that's accurate information. I said, can you bring her into the clinic? We need to start fluids. Yep, she says I can bring her in. And then what time? So we go through these administrative things. I have the front desk. Marla is one of my best receptionists, and she's at the front desk. She says 10:30. Great. And then we'll see you then. And we go ahead and get everything set up. And that's the end of the second consultation. So if you have moments where you're apprehensive about charging for telemedicine because you're worried that you're going to miss something, know that telemedicine will never supplant the in-clinic exam, but when the client has that type of access to the doctor, that makes situations a whole lot safer, because if anything changes, they can reach out and get the best advice from the medical professional.